so Marines and soldiers being sworn in as U.S. citizens in Saddam's palace.
Yeah, boy, that would have been a thrill.
Yeah, no kidding. You know, and I mean, these are people that are willing. They put on the uniform before they even had citizenship.
Right.
And, great Americans.
U.S. Congressman Brad Wenstrup took a tour of the Family Health Center in Waverly on Tuesday, giving him the opportunity to express his support for access to primary care, particularly in rural areas. The congressman also took the time to answer some questions about community health care, the Affordable Care Act, and more. So first of all, kind of what brings you to Pike County and to our health center today?
Well, we were coming here today to tour the center and further drive home the need that we have in a lot of rural communities for primary care. Well, I think it's important, one, that we try to have a good economy so that people can have a job and good access to care, but also there's a need in other areas for care providers, and that's one of the things that we need to look at to incentivize people to come to these areas. But also, one of the key focuses for me is how often can we get people away from emergency room care as opposed to with a primary care doctor, because I think people are better served when they have a relationship with a primary care doctor. Not that the ERs don't provide good care, they do, and they take care of a lot of people, but I think overall it's not necessarily the place for every form of care. For example, your diabetes should not be treated in an emergency department. You should have a doctor that you have a relationship with that takes care of you.
It's kind of up in the air as far as Obamacare, exactly what effect that's going to have on everybody, isn't it? I mean, is there anything we know for sure that's going to change in 2014? Or?
Well, we certainly don't know, because as we're seeing right now, even as it's starting to be implemented, the president is deciding that he wants to take out this part or that part or change some things around. So it makes it very confusing for the American people, not only for providers but for centers like this, wondering what the actual rules are going to be, and that really needs to be clarified. And I think that we have opportunities to make some changes. We want patient-centered solutions. We want people to be able to have access to care and have affordable health care.